Excellent. I'd just like to begin by acknowledging the traditional owners of the lands that we're on today, the Yugambeh people, and pay our respects to elders past, present and emerging, and acknowledge the lands were never ceded. So welcome everyone on this Saturday morning for session 5A. I'm Paul Kamel. I'm the chair of the faculty and delighted to be here this morning to chair the next two sessions. We've got a really diverse range of speakers this morning and wonderful topics, beginning with Mahesh Rajasuriya, talking about a comparison of nicotine to psychedelics, a historic narrative from toxin to medicine, which I think is going to bring a really interesting kind of historical kind of analysis to what we've been talking about over the course of this conference. So Mahesh is the lead psychiatrist at the Riverland General Hospital, Berry in South Australia. Been there from 2022. He has been a senior lecturer in psychiatry with special interests in addictions and psychotherapy at the Department of Psychiatry, University of Colombo, Sri Lanka from 2010, and he's currently reading for his PhD on a topic related to treating alcohol use disorders. So thank you.
Thank you, Paul. Let me begin with reminding you the theme of this conference, the high road and the low road, what happens after the trip? Is there a role for psychedelics in psychotherapy? And my topic is comparison of nicotine to psychedelics, historic narrative from toxin to medicine. I should declare that I am the director of the Center for Combating Tobacco, University of Colombo, Sri Lanka. And my speech will be organized into 4 rounds. Round 1, transformation of the narrative of nicotine. Round 2, transformation of the narrative of psychedelics. And then in the next 2 rounds, I'll take a deeper look at those 2 narratives. So let me begin with, do I have to point it there? Yeah. Transformation of the narrative of nicotine. So this is Luther Terry, the then US Surgeon General, in 1964, releasing his report titled Smoking and Health, Linking Tobacco to Cancer. Newspaper report, 12 dogs developed lung cancer in group of 86 taught to smoke. So this is 1970. So these were not good times for tobacco and cigarettes. And of course, the perceptions that people had about nicotine were negative. So this is an industry commission study, 1970, to determine smokers' attitudes about nicotine. So the attitudes regarding nicotine were fairly negative. 58% of the respondents felt that nicotine is harmful to health. Only 2% believe that nicotine is good for health. There was also a considerable feeling that the US government, Surgeon General, has found nicotine harmful. Nicotine was perceived to be as harmful as tar. Only 12% men and 5% women thought that tar is harmful, but nicotine is not. So basically, people thought nicotine was a toxin. That was the perception they had. Well, then what happens? In 1984, FDA approves nicotine as a therapeutic agent, and a powerful round of advertising begins with very powerful messages like this: beat cigarettes one at a time while keeping your weight under control. And there were lots of positive reports on newspapers, and obviously the perceptions changed. Just 3 years after this, another industry commission study done by Philip Morris together with Leo Burnett found that in general, nicotine was judged to be a key to overall smoking satisfaction. It was not without health implications, but the effects were largely seen as short-term. Tar, on the other hand, was globally linked to lung ailments and the health hazards of smoking. So one participant actually said, tar remains in your body, but nicotine only has a temporary effect on you. Interestingly, the fact that nicotine gum was prescribed by their doctors and endorsed by their pharmacy led some people to conclude that nicotine must not be all that bad for them. So basically, the narrative has changed from toxin to medicine. And next came the e-cigarettes and another round of compelling, powerful advertisements. And the word nicotine was everywhere. In 2009, the WHO included nicotine into their list of essential medicines, and many countries followed suit. So this is the narrative of nicotine, starting from, 1950s, and currently, where are we? What are the perceptions that we have now about nicotine? So let me quote two studies. The first one, 41% of adults believe that electronic delivery of nicotine was less harmful than cigarettes. However, those who believed so were found to be less knowledgeable about the overall health risks of smoking. The other study tells us that 20 to 60% of survey participants claimed that nicotine patch and gum are as harmful as combustible cigarettes, with cancer and heart disease cited as the potential consequences of long-term use. So it's a bit of a mixed view that we seem to have today about nicotine. And that brings me to the end of the first round, transformation of the narrative of nicotine. Now let's take a look at the transformation of the narrative of psychedelics. Formal mainstream psychedelic research began in 1895 with this paper published by Prentice and Morgan on mescaline. And this is the proportion of psychedelic research among published scientific papers, and it grew steadily, especially in the 1950s. And these are two important personalities, mainly doing research in Saskatchewan Mental Hospital, which is a hotspot of psychedelic research at that time. Humphrey Osmond, he was the clinical director and later superintendent of the Saskatchewan Mental Hospital in Weyburn, Canada. And Abraham Hoffer, psychiatrist and biochemist, he's a Saskatchewan native. He was working at the Provincial Public Health Department in Regina, Canada, two far apart places, but they worked together. Their research included working on model psychosis using LSD and mescaline. They thought healthcare staff could gain valuable insight into their patients by temporarily experiencing psychosis through a guided LSD trip. They also researched the effects of LSD on alcoholism. They suggested that an LSD trip mirrored hitting rock bottom that happens in patients with alcoholism. Unfortunately, alcoholics refuse help until reaching that stage. That's what they thought. Osmond and Hoffer reasoned that they could hijack the natural course of the disease by giving alcoholics LSD before they reached the actual rock bottom stage. So this is Dr. Humphrey Osmond speaking on radio in 1960. This is how they spoke on radio those days, all dressed up and standing. What I want to highlight here is that they were regarded very positively who were doing psychedelic research. But not everything was positive about psychedelic research. This another New York Times report, turn on, tune in, and drop out. LSD users describe their experiences during a psychedelic trip. If you look at the bottom, you will find LSD spread in US alarms doctors and police. Authorities see education as key hope in curbing peril of the hallucinatory drug, helping young people overcome pills, pot, and psychedelics. So lots of negative reporting, but there were positive reports as well. These about a psychedelic show. And these were the times of psychedelic rock, which generated positive as well as negative responses. And what happened in the end? So there were growing, polarized world, pro and anti-psychedelic campaigns, and ultimately, in 1967, the United Nations classified psychedelics, including mescaline, psilocybin, and LSD, under Schedule 1 of the UN Convention on Drugs. This legally defined them as having no accepted medical use and as having the maximum potential for harm and dependence. This successive national legislation throughout the Western world tended to mimic the 1967 UN schedules, such as the Controlled Substance Act of the US in 1970. So do you want to know what happened to this graph? Obviously, it died a natural death, well, an induced death. So the narrative of psychedelics starting from the first era of psychedelic research in 1895, going through these tumultuous times, and then having sort of the dark ages of psychedelic research. But then things started to change in 1990s, and they really took off in 2010, peaking in this workshop organized by the NIH in 2022, titled Psychedelics as Therapeutics, Gaps, Challenges, and Opportunities. It's quite a change. So in this world, well, now, what are the perceptions that people have about psychedelics? So this is about medical students. 132 medical students participated in this survey. Overall positive attitudes towards psychedelics. 78.6% agreed that psychedelics have therapeutic potential. 95.2% agreed that psychedelics deserves further research. And this is a paper on psychedelic perceptions of mental health service users. 72% supported further research. 59% supported psilocybin as a medical treatment, while 20% viewed psychedelics as addictive and unsafe, even under medical supervision. So the narrative of psychedelics is making huge gains in the recent past, and the latest is in 2023, Australia approving psychedelic use in clinical practice. And let me take you to the TGA website explaining their decision, understanding the changes to MDA and psilocybin access. So let me read the first sentence only. There is emerging evidence that these medicines may help people with specific mental health conditions that other medicines and therapies can't treat. The point I want you to concentrate on is the wording that is used. Medicines, mental health conditions that other medicines and therapies can't treat, medicines containing MDMA and psilocybin, prescribed to treat depression that is resistant to other treatments. So lots of positive connotation about health-friendly words used. But this report is not like that. This is from September 2023. We don't want to run before we walk. The attitudes of Australian stakeholders towards using psychedelics for mental health conditions. So what it basically says is that stakeholder representatives and politicians agree that insufficient evidence exists to support the widespread clinical implementation of psychedelics in Australia. Politicians also perceive the stigma associated with psychedelics might negatively influence progressive legislation. So that's the transformation of narrative of psychedelics. Now let's move on to round 3, a deeper look at the transformation of the narrative of nicotine. Now, when you talk about nicotine, you can't ignore the elephant in the room, that is the tobacco industry. So there's a very interesting observation on tobacco industry in the narrative of nicotine. That is, tobacco companies initially opposed NRT, but by the 21st century, they were marketing their own NRT products. How did that happen? The answer is in this paper, Tobacco Industry Research on Nicotine Replacement Therapy. If anyone is going to take away our business, it should be us. Co-authored by Stanton Glantz, former director of the Center for Tobacco Control Research and Education, along with one of his PhD students, by examining the Truth Tobacco Industry Documents. What is Truth Tobacco Industry Documents? It's an archive of 14 million documents created by tobacco companies about their advertising, manufacturing, marketing, scientific research, and political activities, hosted by the University of California, San Francisco Library. So this is the gist of their paper. Timeline of tobacco industry, NRT research, and product development. So let me take you through this timeline. In 1950s, as far back as 1950s, Philip Morris Research and Development Division works on development of nicotine gum. All these are tobacco companies, R.J. Reynolds joins in, Brown and Williamson joins in, but they give up because they fear regulation by FDA if this is a medicinal product. So everybody gives up. And then the perceptions, they check, they find tobacco industry research shows consumers perceive nicotine to be dangerous, which I presented to you a few minutes ago. So therefore, they start researching on reduced nicotinal products because nicotine is so bad, let's have less on our products. And then what happens is the approval of nicotine as a therapeutic agent in 1984 by FDA and the powerful advertising campaign. And then just after 3 years, the tobacco industry finds that the consumers no longer perceived nicotine to be dangerous because of NRT campaigning, which I presented to you as well a few minutes ago. So then, Philip Morris terminates research on reduced nicotine products. There's no need to. And then they start marketing their own nicotine products. So that's how, although tobacco companies initially opposed NRT, by the 21st century, they had begun marketing their own NRT products. One more important happening from this timeline that I want you to be aware of is that in 1992, Philip Morris research revealed that use of nicotine patches had no effect on real-world quitting. This is the official document, which was discreet those days, now it's public. Philip Morris USA Inter-Office Correspondence. The following provides a brief summary of our learning on the nicotine patch to date. Clinical results indicate that the nicotine patch was more effective against placebos. Success rates for nicotine patch 17 to 36% compared to placebos at 4 to 26% in impacting smoke abstinence. It is important to keep in mind, however, that in objectively validated tests, 1 full year after quitting, nicotine patch scores were less impressive versus placebos. Some sort of behavior modification was administered during the clinical tests. Without some degree of psychological therapy, many experts warn that the nicotine patch is powerless. This was 1992. They're always ahead of us. So we took some time to realize this. Real-world effectiveness of smoking cessation treatments, a population study, which found that smokers who buy nicotine replacement therapy over the counter with no behavioral support have similar odds of success in stopping as those who stop without any aid. So in other words, NRT alone has no effect on smoking cessation. That's my round 3. So let's move on to the final round. A deeper look at the transformation of the narrative of psychedelics, which I think you have already started thinking of, and you probably see the obvious parallels between the narratives of nicotine and psychedelics, which I'm not going to repeat, but I'm going to raise 2 important questions. One, like the tobacco industry in NRT narrative, are there equivalent forces operating in benefiting from or even writing the narrative of psychedelics? I think you can figure it out, you're thinking, but I would aid you with just one comment. In a sense, the tobacco industry may be thought of as being a specialized, highly ritualized, and stylized segment of the pharmaceutical industry. Tobacco products uniquely contain and deliver nicotine, a potent drug with a variety of physiological effects. This is a 1972 memo titled RJR, that is a tobacco company, Confidential Research Planning Memorandum on the Nature of the Tobacco Business and the Crucial Role of Nicotine. Just a passing comment that the psychedelic industry is going to reach its worth of 10.7 billion in 2027. Well, the next question. NRT is not effective on its own. works only when coupled with another psychosocial intervention. Does the same hold true for psychedelics? Perhaps the question we need to ask before that is that do psychedelic work at all? Let me take you to this study. The efficacy of MDMA for post-traumatic stress disorder in humans, a systematic review and a meta-analysis. So the findings were promising evidence for the potential therapeutic use of MDMA alongside psychotherapy in the treatment of PTSD. Well, let's take a deeper look at this paper. So these are the studies. Don't worry about the text. The studies that they pulled together. Look at the sample sizes. 6, 20, 12, 28, 12, 26, 32, 4, 6, 10. So they have pulled 10 studies together and came up with only a cumulative sample of only 168. So we need more research. What we can say at this stage is we need to exercise caution. That's a main message that I want to convey to you. I would leave you with this paper from our own journal. Why didn't the TGA consult with Australian researchers and clinicians with experience in psilocybin-assisted psychotherapy for treatment-resistant major depressive disorder? Russell, Michael, Williams, Castle, the local experts who are involved in a trial, do answer this question in this paper, if you care to read it. Why were local experts not consulted? Well, the answer is, we don't know. So that's what I would leave you with. Thank you.
I just was wondering.
We can hear you. Yeah.
Sorry. Yes. Right. Now we're good. Would you care to speculate on why you think the TGA did not consult with local experts? Do you have any theories of your own in relation to that, or from discussions with colleagues?
Thank you. I don't know whether we are here to speculate. We can speculate inside our heads, but what the narratives of, by studying the narrative of nicotine, I mean, we don't know whether somebody lobbied FDA in 1984. Maybe they did, maybe they didn't, right? So we don't know. I mean, I'm drawing parallels between these two narratives. So you can start speculating on your own, learning from the older narratives. 20 years from now on, somebody might say, yes, they were lobbied, or whatever, or they were not. I don't know. As you said, I can speculate. Well, we can speculate anything, but perhaps the important thing here, the scientific thing to do here, is to draw the parallels from the nicotine narrative and see what could have happened and might be happening, and perhaps above all that, what precautions we need to take now, and how to guide this narrative. This narrative can be guided, right? It's not to squash psychedelic research. How can we guide this narrative in the most scientific way? I would stop there in answering that question.
Yes.
Yes.
Thank you for that. Excuse me. Thank you for that comparison. It's very interesting. I'm just wondering if you have any understanding of how addictive nicotine is in comparison to psychedelic, because there's a sort of a discussion about the addictiveness of psychedelic, but from what I've read so far, it seems to be quite low in the addiction scale, whereas nicotine, as we already identified, is highly addictive. I'm just wondering whether you have any understanding, maybe something that you've researched or read that you can help us with that.
Thank you for that question, and perhaps the parallel comes from cannabis. So cannabis also has a low addictive potential, but what we see in the real world that there are lots of people who are using cannabis every day cannabis use disorder is a well-recognized condition and a major problem. And as psychiatrists, we see so many patients coming in with cannabis use and consequences. So yes, addictive potential can be looked at in various aspects. The biochemical aspects, the reward pathway and reward circuitry and all that, and also from a public health perspective. So I think it's a considerable burden that we have with almost all these chemicals as substances of abuse. Yeah, I do agree. Biochemically, it's found to be less addictive than nicotine.
Probably got one more.
Yeah. I wish I had included that too in my presentation, the OxyContin saga in the US. You can watch this interesting Netflix documentary called Painkiller.
Yeah.
It gives a story. I think this is the concern that the authors of that paper had that I presented last, right? They are researching psychedelics. They are researchers of psychedelic assisted psychotherapy. So they are not anti-psychedelics, but they are urging us to exercise more caution because of concerns like what happened in the US with OxyContin, unregulated, introduction and all the rest of the things that happen. So I think again the advice is caution, and that's what we need, keeping these kinds of things in mind. Oh, I would rather not. Yeah. I think Paul is trying to conserve.
As the moderator, I'll take that as a comment. We have one last question or comment, and we'll move on.
It's mostly a comment. Thanks, Mahesh. Now, just drawing a parallel between, say, in rare forms of cancer treatment, you don't have too many patients, but they are approved, and it's easier to get those sort of treatments. In this situation, we are dealing with patients who haven't sort of really gotten better with any of the conventional treatments, medication, psychotherapy, whatever it is, a combination of both. And they're at the brink. Maybe that was a consideration for the TGA to expedite the process. Yesterday, we heard defense veterans talking about their experiences, and nothing else worked. But some interventions, which as we probably all agree that there is not that kind of evidence which large-scale RCT, but still there is evidence and people have benefited. Maybe that was the approach TGA took. Thank you.
I agree, but just one comment. I don't think as scientists we should not work out of desperation. It should be based on science.
Just, the parallel comes from cancer treatment. Again, there may be not many patients, some rare form of cancers, but treatments get approved. Just a comment. Thank you.
Wonderful. Thank you for that, and thanks for everyone's participation, and thank you, Mahesh, for that presentation.